Part 7. Let's dive into Medicare enrollment periods. These periods determine when you can sign up for or change your healthcare coverage. Understanding these windows is crucial for getting the benefits you need. It helps you avoid penalties and make plan changes that fit your situation. First up is the Initial Enrollment Period, or IEP. This is your first chance to sign up for Medicare, lasting 7 months. It starts 3 months before you turn 65, includes your birth month, and extends 3 months after. During this time, you can enroll in Original Medicare, a Medicare Advantage plan, or a standalone Part D plan. If you're already receiving Social Security, you might be enrolled automatically. But don't wait. Missing this window can lead to costly penalties. Next is the General Enrollment Period, from January 1st to March 31st each year. If you missed your IEP, this is your chance to sign up for Parts A and B. Just remember, late penalties may apply, and coverage starts the following July. Then we have Special Enrollment Periods, triggered by life events. If you move, lose employer coverage, or qualify for Medicaid, you can enroll outside the usual windows. These periods are essential to ensure you're not left uninsured after a major change. From October 15th to December 7th, it's the annual Medicare Advantage and Part D open enrollment. This is your time to review and adjust your coverage for the next year. Changes take effect on January 1st, so make sure your plan still meets your needs. Finally, from January 1st to March 31st, you can switch Medicare Advantage plans or return to Original Medicare. This is a great option if your current plan isn't working for you. Switching plans is easy during these windows. Just compare options and apply. Once your enrollment is processed, your new coverage starts the following month. Understanding these periods ensures you have the right Medicare coverage for your health and finances. For more information, reach out to Kris Keush,